Okay, so this is part one of the Bioinspiration paper. This will be the presentation portion of it. So my presentation is entitled Inspired by a Parasitic Hookworm. So as we should all know, bioinspiration is being inspired by biological structures or processes of other organisms. We see many examples of this in everyday life. A few of them are, gecko feet inspiring adhesives, mosquitoes inspiring the hypodermic needle, and spider silk inspiring sutures. The organism I want to focus on is Ancylostoma duodenale. This is a parasitic nematode, commonly known as the hookworm. Over here, we can see its classifications as kingdom, phylum, class, etc. Because it's a parasite, it needs to travel into the body somehow and infect its host. And this organism in particular goes through your skin or your mouth. So it'll go through your skin and your feet if you step on contaminated soil. In this case, it's feces contaminated soil, or it can go through your mouth if you eat contaminated food. It's prevalent in many foreign countries. A few of them are Africa, Asia, Europe. So its lifespan is up to 2 years, and this 2 years refers inside of your gut. It can be there for 2 years. The size differs between females and males. Females are slightly longer than the males, and they have 2 pairs of ventral teeth, which dig into the colonic wall, and we'll talk about this a little bit more. So here's the mechanism of action. So first you have the eggs, and these eggs come from the feces. Now let's say these eggs are in the soil now. Then they develop into rhabditiform larvae. After 2 molts of this, it's going to develop into an adult form, which is the filariform larva. Over here, it's ready to infect. It's ready to travel through skin now. So steps 1 to 3 are all in soil. And then step 4 is obviously inside the host. Now it's through the skin. It doesn't matter if it's broken skin or unbroken skin, it can still get through. Now, when it gets through, its first target is the lungs. Okay, that's the first place it's going to go. It's going to go in through your bloodstream to the lungs. And when it's in the lungs, 2 things can happen. You can cough it up, because when you walk past a polluted area and now you're coughing, that's because there's foreign particles inside your lungs, and your instinctual reaction is to cough it up. And when you cough it, it ends up in your larynx, in your throat area, and then some cilia come, they grab it, and they take it down your stomach, and the stomach acid takes care of the rest. Now, in this case, the same thing happens. It makes its way down to the GI tract once you cough it up. Another thing that can happen is when it's in the lungs, the pulmonary veins can take it back to the heart, and then the heart pumps it out, through systemic circulation. The end goal is for it to end up in your gut, in your intestines, okay? Now, it can also travel through your mouth, but when you swallow it, it's already going to end up in your gut. So, that's pretty simple for it to do. So anyway, now when it's in your gut, those teeth that I mentioned earlier, they're going to dig into your intestine, particularly the small intestine, and they're going to take in blood, because this parasite ingests blood from intestinal tissue. That's how it survives. So these are the various forms of it. Here's the rhabditiform larva that we talked about, and this is the adult form right over here. And in the adult form, you can see the teeth over here. This is a little bit more realistic. Here are the teeth. And in this picture, it's showing that it's attached to the duodenum. nearly all the literature states that it attaches to the small intestine, if not somewhere on the colon, not the duodenum. I don't know why they did that in this picture, but I chose it because it's a very clear picture. So nevertheless, some of the symptoms are respiratory and gastrointestinal distress. Respiratory because it ends up in your lungs initially, and that's going to cause difficulty with your respiration and breathing. Gastrointestinal distress for obvious reasons. You know, it can cause a condition that's known as intestinal hookworm disease. There's bleeding lesions in the GI tract because it bites into your GI, into your colonic wall and sucks in blood. And through blood loss, you have iron deficiency anemia. So basically, iron produces red blood cells, and well, it produces hemoglobin, and hemoglobin attaches to oxygen and gives you energy. But in this case, since there's such few red blood cells, because they're all being taken away by the parasite, you're gonna have shortness of breath, and you're gonna have fatigue, common symptoms of anemia. Here are a few other symptoms on this graphic to the right over here that are also common with intestinal hookworm disease. The treatment is fairly simple and straightforward. It's only a 1 to 3 day treatment. It's inexpensive, and these anti-helminth drugs are safe and effective. So as long as it gets treated, chances are you'll be fine. The challenge is to diagnose it and figure out what's going on. Figure out if you walked in contaminated soil barefoot or not. Anyway, what did this inspire? Well, Johns Hopkins University researchers aim to solve the problem of poor efficacy GI drugs. So efficacy means how well a drug works. So if I took extra strength Tylenol, 500 milligrams, and it cured my headache in 1 hour, and then I take another drug that of the same dose and it cures my headache in 30 minutes, the other drug is better because you're taking the same amount and it's causing the same effect, cured headache, but it's taking less time. As long as the side effects are the same or none, the other drug's going to be more efficacious. So the reason these GI drugs are of poor efficacy is because the body gets rid of them before they can give their full effect. And the way it does that is intestinal motility. When the intestine relaxes and contracts naturally, it's going to shake off these chemicals from the drug. They're not going to be on the receptor as well anymore. That's one way. Another way is because of hepatic first pass metabolism. All that means is once you ingest a drug orally, it goes through your liver, and then the liver detoxifies it. So the liver makes it less bioavailable, as they say. That's why when you take IV medication, it works instantly because it goes into your bloodstream right away. Whereas if you take it orally, it has to go through the liver, and it's a whole process. So what they did was they mimicked the teeth of the hookworm by creating a robot that can autonomously fold and bite onto the colonic wall. So similar to how the hookworm bites onto your intestinal tissue, this device that they made can also bite onto it, and it can excrete medicine directly after it attaches on. That way it can be shaken off. Just like the parasite can't be shaken off by your intestine, this won't be shaken off either. It's metal. They're only 250 micrometers. They're called therapeutic grippers, so they call them Theragripers. They're very small. Thousands of them can be injected or taken at once. They contain a parafilm layer, and that's going to be important. We'll see in the next slide or so. They contain sharp microtips. These microtips are what are going to be digging into the intestinal tissue. So they latch onto the colonic wall and release medication. So this can be released into the body endoscopically or rectally. In experiments, it's been tested both ways on 2 different organisms. Their main goal is also to travel to the GI tract and latch onto that intestinal tissue. The body temperature softens the parafilm layer, and once that happens, the device automatically folds or closes in on itself. And when it closes, those teeth dig in to your intestines. And once that happens, they release medication. So over here, we have this, cute picture of this, of this, of the worm, the parasitic worm. These are the two pairs of teeth. And this is the Theragripper. It has 6 sharp tips, has a star-like shape, and this circle over here, this circle is going to contain the medicine. Now this graphic shows it being dug in to the tissue, and this green is representing the medicine. So the idea is it's going to clamp itself all across this tissue, and the medicine is going to be released directly. Over here, this is a human figure. This has never been tested in humans, but this is the idea. They did this in rats. They used compressed air in rats. So basically, thousands and thousands of these Theragrippers will be in here. They'll be shot up, and all these little specks represent Theragrippers. So the experiment in rats was very successful. The Theragrippers were introduced in vivo rectally through pneumatic microfluidic controller, which is just a shot of compressed air. They released pain medication. In this case, it was ketorolac. And then there was also another control group that was given oral medication, the same medication, just orally. So the results indicated that the pain medicine stayed in the Theragripper group longer than the group that took it orally. There was no pain or discomfort observed. So these rats were just, doing their normal routine. They didn't show any abnormalities. So this is a radiographic image that they took in the rat colon. So these are the 6 sharp microtips inside the rat colon. And then over here, this is where the medication would be released. Now, in pigs, it was introduced endoscopically. The imaging indicated that they stayed in for about 24 hours. There was, again, no pain, discomfort, perforation. There was no obstruction observed. An MRI after 4 weeks showed that there was no evidence of Theragrippers. That just means that they were discarded and excreted safely. So where do we go from here? Well, the 2 experiments on the rat and the pigs, suggest that we should test it in humans. What if we can modify Theragrippers to go to more than just the GI tract? What if they can cross the blood-brain barrier and help patients with with brain disorders like Parkinson's or any other type of encephalopathic disorder? Or what if we can get them to specifically target cancer cells and release chemotherapy just on cancer cells so that it only works on those cells and it doesn't poison all the other good cells? What if once they're excreted, we can somehow harvest the bad tissue for biopsies? There's a lot of possibilities. So this is an extremely recent discovery or creation or invention, I guess. It's only been published a few months ago. Late 2020 is when this finding was published. So it's been getting a lot of traction. It's also been a topic of conspiracy, because people are like, well, now they're literally injecting us with robots. Maybe that's in the COVID vaccine, and you know, what if it goes to our brains and all of this stuff? It's, you know, it's false, but I feel like conspiracy theories are mainly just entertaining. That's why people get behind them, because they're entertaining. I don't think anyone truly believes them. But yeah, that's my presentation for part one. And yep.